I wanted to take time to address Nevadans directly on a growing issue we're seeing in some of our communities as we continue on this historic COVID-19 vaccination effort. As the state's immunization team has said from the start of this effort, we are focused on vaccinating as many Nevadans as possible, as quickly as our allocation allows. I, along with my team and in coordination with the federal delegation, continue to push for more doses of the vaccine to be allocated to our state. In the last month, we've made incredible gains, leveraging every state resource to make sure we're able to expand vaccination sites, get more boots on the ground with the support of the Nevada National Guard and federal personnel, expand the vaccinator workforce, and clear a data backlog that existed in Southern Nevada. While substantial progress has been made to ensure doses are being administered, challenges still remain. But there's no problem that we cannot solve as a state when we work together. One of the major challenges we have identified is equity and fairness. The Nevada COVID-19 vaccine playbook was recently updated to incorporate recommendations provided by a number of state and community partners who support equitable practices in public health and other adjustments to meet the unique needs of Nevada's population. When this playbook was developed, it was based on the understanding that each state would be provided a limited number of initial COVID-19 vaccine doses. So entire populations must be prioritized. That's no easy task, but the state immunization team, in consultation with federal and local partners, developed Nevada's priority lanes, which include essential, frontline workforce, and general elderly population. When they developed these prioritization lanes, they made sure they were guided by scientific data and ethical principles, including mitigating health inequities. We have also been steadfast in our commitment to equity in our vaccine distribution model. Our team has spent so much time working with local health districts and counties to ensure they understand that equity is a critical component. According to the vaccination data released by the Southern Nevada Health District yesterday, and additional data sent to our office, Clark County is facing an equity crisis. It must stop. As a former Clark County commissioner, I know these zip codes well. I am alarmed at what I am seeing. What the data shows is clear. There is a disparity in who is receiving the vaccine that does not reflect the demographics of that region. Additionally, the zip codes that continue to experience the highest number of COVID-19 cases are the same zip codes with the lowest frequency of vaccinations. That makes no sense. These zip codes represent Southern Nevada's working class families, lower income households, and communities of color. At the same time, we are reading and watching the same news media reports as many Nevada families do. We are seeing rumors and substantiated examples where people are getting access to the vaccine who are not yet eligible. It is not fair, and that must stop. Vaccines are a scarce resource, and they are in high demand right now. I get it. That's why the Nevada Playbook supports equitable vaccine distribution. We have to manage this process fairly and equitably while we wait for more doses. We've prioritized the general population, starting with those 70 and older, because they have experienced the highest mortality rates as a result of COVID-19. We also prioritize frontline workers, like doctors, nurses, emergency responders, grocery store clerks, and others who are critical to keeping our state running while keeping Nevadans safe and healthy. It's the essential workers, those who cannot work from home. Individuals who have been able to work from home should not be accessing the vaccine before frontline workers or our senior citizens. It's simple. The playbook makes that abundantly clear. I do not blame those that have been offered a vaccine for taking that opportunity. The blame rests squarely on the shoulders of those in leadership positions. They know better. They have a responsibility to uphold the integrity of the playbook. They also have access to the state immunization team, who have answered these clarifying questions multiple times. I'll repeat, they know better. To put it plainly, when those in charge disregard the playbook, it results in an unfair allocation of vaccines, confusion among the public, and line skipping. It results in inequity. It is unfair and it cannot be allowed to continue. Additionally, every time a group is allowed to be vaccinated who is not eligible, those doses are being taken away from someone's grandma or grandpa or a frontline worker who has been showing up every day throughout this pandemic. To help ensure that this pattern of inequity stops now, I am announcing a Fairness and Equity Initiative led by our state immunization team to get Southern Nevada back on track. They will be tasked with confirming that equity remains a cornerstone of all our efforts. Under this initiative, the state will work with the Clark County Emergency Management and Southern Nevada Health District in the immediate time to clarify prioritization lanes, support fair access to vaccines throughout site selection, and equitable allocation across communities. Updates and progress will be reported publicly to the COVID-19 Mitigation and Management Task Force. If equity and fairness issues arise in other areas throughout the state, focus will be given to alleviate challenges there as well. But in the immediate, I am asking them to direct their attention to Southern Nevada, where the problem exists. I know what folks will say. We don't have enough doses. They're right. We don't have enough doses, which is why I've been fighting to get more doses every single day, along with every other state that's fighting for the same thing. In the meantime, it's up to us to consider fairness and equity in how we allocate the limited doses we have. Whether we have 15 or 15 million, we have the responsibility to make sure they are distributed fairly to all communities. Emphasize all. People will say there's vaccine hesitancy, and that's why communities aren't getting vaccinated. That's partly right. There is vaccine hesitancy, but there's more people in every community of Nevada who want the vaccine right now than there are doses available. The demand greatly outweighs the supply. Additionally, with the recent infusion of federal funding, the state is stepping up its partnership with Immunize Nevada to expand marketing and outreach to all communities. We need all our local leaders to join in this effort to ensure that Nevadans understand the safety and efficacy of vaccines that are available. It's a disservice to our residents if local leaders are not sharing accurate information. There is no question the vaccines are effective, they work, they save lives. Any elected official questioning that is just plain wrong. Equity requires an intentional effort to reach every community and not create a situation where those who have been disproportionately impacted by this virus are left behind. I want to assure you that I'm waiting my turn, along with my entire office, along with the First Lady. None of us have received a shot of the vaccine yet. We will not do so until we are eligible. You have my word on that. We have not and will not jump the line, and others shouldn't either. Elected officials should lead the way. As I said earlier, there's no challenge this state cannot overcome when we work together, but we must work together. I know Southern Nevada well, and I'm confident this partnership will help us accomplish our goal of fairness and equity. Thank you all.